Hello, we're going to talk about movements at the shoulder girdle. Scapula elevation. Superior movement of the shoulder girdle in the frontal plane, like shrugging your shoulders. So bringing those shoulders up, bringing those shoulders right up so that you're hugging those shoulder blades in. Scapula depression is bringing those shoulder blades back down to normal. So from coming up from the shoulder elevation, we're going down to the scapula depression, which is inferior movement of the shoulder girdle in the frontal plane. Scapula abduction or protraction. Forward movement of the shoulder girdle in the horizontal plane away from the spine. So we're going to be down on the floor for this one. So you're bringing that shoulder blades right up. And then scapula adduction or retraction is the backward movement of the shoulder girdle in the horizontal plane toward the spine. So bringing those arms right back down. Scapula upward rotation. Rotary movement of the scapula in the frontal plane with the inferior of the scapula moving laterally and upward. So bringing those arms straight up. Scapula downward rotation. Rotary movement of the scapula in the frontal plane with the inferior angle of the scapula moving medially and downward. Occurs primarily in the frontal plane. The return upward rotation. So you're bringing those arms back down. Movements at the glenohumeral joint at the shoulder. Shoulder flexion. Decrease of the angle at the joint occurs in sagittal plane. So you're bringing that arm straight up. We're going to decrease that angle at that joint. Shoulder extension, you're going to bring that arm straight back down, increasing that angle at that joint. These both occur in the sagittal plane, both shoulder flexion and extension. Shoulder abduction. Movement away from the body occurs in the frontal plane. You're bringing that arm up. Shoulder abduction. Bringing away from your body. Shoulder adduction, movement toward the body, occurs in the frontal plane. Bringing that arm back down to your side. How I think of it is adduction, adding onto your body. Abduction, away. Shoulder internal rotation. Rotary movement around the longitudinal axis of a bone toward body. Occurs in transverse plane. So you have your arm out to the side, and you're going to bring it right in front of you. Shoulder external rotation. Rotary movement around the longitudinal axis of a bone away from the body occurs in the transverse place. So how we had it before when we brought that arm in, this is the opposite. You're bringing that arm out straight to the side. Shoulder horizontal abduction. Movement of the humerus in the horizontal plane away from the body. So we'll be down on the floor again for this one. Alright, so this is the shoulder horizontal abduction. Your arm will be down on the ground, and you'll bring it up to the side. Shoulder horizontal adduction, bringing that back, is movement of the humerus in the horizontal plane toward the body. So you're going to bring that arm back down to your side. Movement at the hips. Hip flexion. Bending movement that results in a decrease of angle at the joint. Occurs in the sagittal plane. For this one, you'll be sitting down. You're going to bring that leg up, decreasing that angle of motion. That angle between your hip is now decreased. Okay, so for the hip extension, you're laying on your tummy, and you're going to bring that leg straight up, increasing that angle at that joint. Hip abduction is the lateral movement away from the body in the frontal plane. This one you're laying on your back. And this one you're going to bring that leg away from your body. Hip adduction, movement medially toward body in frontal plane. So you're bringing that leg back down, adducting, bringing it back towards your body. Hip external rotation. Rotary movement around longitudinal axes of a bone away from body occurs in transverse plane. So you're going to bring that around and all the way through. You're coming in and around. That's external rotation. Hip internal rotation. Rotary movement around longitudinal axes of a bone toward the body occurs in the transverse plane. This one is opposite to the external rotation. You're going to bring outside and in. The knee. Knee flexion. Bending movement that decreases the angle at a joint in the sagittal plane. We're standing straight, we're going to bend that knee. We've decreased that angle at that knee joint. Knee extension. Straightening movement which increases, bringing that right around. Knee internal rotation, rotary movement around longitudinal axes of a bone towards body occurs in transverse plane. So this time you're coming in towards yourself. Movements at the lumbar spine. Lumbar flexion, bending movement that results in a decrease of angle at a joint in the sagittal plane. So this one you're going to be down on your bum and you're just reaching up. That is lumbar flexion. Lumbar extension is straightening movement that results in an increase of joint angle in the sagittal plane. So this one you're lying on your tummy and you're going to bring that upper body straight up. The lumbar lateral flexion, movement of head or trunk in frontal plane laterally away from the midline. You'll be laying on your side, and you start down at the ground, and you're going to bring that back straight up to the side. And the reduction is the return of the spinal column from the lumbar lateral flexion. So that's bringing yourself back down to the ground from the lateral flexion. The lumbar rotation unilateral is in the transverse plane, and it's movement of one side. So you're going to bring it to that one side. And that is the movements of at our joints.